You were on the drugs. It was good for a year.
Yes.
And then the second year, was it as good?
No, it was. I only took the drugs according to the doctor's intermittent therapy. Intermittent means they only do it for 1 year, or the doctor in America actually does it for 13 months, and then you stop, and you just continue with the Avodart, or an alternative drug which I took as well, called Prostate, and you just continue with that and monitor the PSA, and if the PSA is normally, with all his patients, most of them, the PSA remained stable for 8 years, and nobody needed another dose of hormones.
Oh, I see. So the first year treatment is a really so-called a massive treatment, a strong treatment.
Hit it over the head strongly.
And then you use the second one as a maintenance.
And they call it maintenance. They call it maintenance with the Proscar or the Avodart.
But in your case, after this 1 year of maintenance, it did not maintain?
That's correct, Dr. Chris. That's correct. Of course, I had the graph. I had a graph from the presentation from the doctor of the first 100 patients who were on this intermittent, and the graph of the PSA was going up to about 4. Maybe after some years it went from a low level up to about a level of 4 or 5, maybe something like this was the average. But with me, after stopping the hormone therapy, I was off hormone therapy for about a year, 1 year. But then the PSA started rising. It went from 0.01, then it went to 0.22. 0.22, and I thought, well, it's still low, but the percentage increase is very high, of course. So from 0.22 in the next, it was either 1 month or 6 weeks, this is quite a short time frame, it went from 0.22 to 1.96, and then in the next 6 weeks it went from 1.96 to 4.1. So if I plot a graph myself, you can see it's a parabolic exponential curve going up. I was getting worried, you see.
Yes, how do you feel? That I wanted to know that having seen it's going up, it's not maintaining. How do you feel at that time?
Worried.
You feel worried?
I feel worried because obviously what I'd hoped would have happened, the PSA staying low for 8 years on the after the 1 year of hormone, it didn't happen. It appears to be going, and it appeared to be going up faster than the average of the 100 patients on the graph.
What did the doctor say about that?
He said, I asked him, of course, and he said, well, you were a high risk, what he called a high risk patient, which he did tell me in the first place. I was a high risk patient because my PSA was quite high to start with, 19.6, and over 20 PSA, some doctors call it a high risk. Okay, although my Gleason score was not bad, it was 3 + 3 = 6, and the grade was supposed to be T1C, which is confined to the prostate. So, but according to the PSA, it was quite high. So when I asked my doctor about this, he said, well, you were high risk, so maybe your PSA will go up higher than the average, but let's see, and if it goes up a lot, we'll have to think of something else, but let's see. His favourite expression was, it is what it is, which is fair enough. The PSA, it is what it is.
But you remember also that you were also on the diet.
I was on this Budwig diet at the time, yes.
So you had actually both when the rest really don't have both.
That's right.
But if you were, say, minus your diet,
Yes.
it could have shot up.
Quite possibly.
Possibly.
We don't know. We don't know, but quite possibly. The diet might have done something to help. Yes,
Yeah.
I agree.
Yeah.
It's difficult to say.
Right. So, well, that was it.
Yes.
So, when it went up high, you were frightened, and the doctor say, let's see. And you are not prepared to see yet at that time.
Well,
so, how do we come into the picture?
Well, I could see I am an engineer by training many years ago, but don't ask me anything about engineering now. So I could plot my own graph on a piece of paper, and I can see this is an exponential curve going up. And if I don't do anything, the PSA, I've shown it to other people, and you can see by the graph, that if in another 6 weeks, the PSA, looking at the graph, would double again from 4.1, it would have gone to 8. I asked my doctor in Singapore, well, when do you want me, what do we do now? Do you want me to go back on the hormones or what? And he said, well, if the PSA is going up too quickly, and if you don't have a low PSA for 2 years after you stop the hormone treatment for 2 years, then maybe the hormones isn't the right way to go anyway, and he would then recommend radiation, some sort of radiation, to blast the radiation. Yes.
So you're back to square one again.
I am back to square one. The doctor in Singapore recommended a certain type of radiation he favours himself, called tomotherapy. It's a name of a particular radiation machine, something like IMRT radiation, but supposedly a bit better, more accurate supposedly, and they don't have this machine in Thailand, they have it in Hong Kong. So I just asked Hong Kong how much they wanted for this treatment in Hong Kong.
This in Hong Kong would have cost what? You said
$50,000, they said. US dollars.
US 50,000.
50.
Oh, 50.
50, not 15, 50.
50 US for the whole session. But what's the chance of?
I didn't go into that.
You didn't go into this.
All I know is the chance of their high dose radiation, which included external radiation in Thailand, and I don't know because I only spoke to the doctor. I didn't get a quotation from them, but I would say maybe $15,000 or $20,000 here.